My name is Carolyn Halley. I'm a family practice physician and I've worked with HealthPoint for 13 years, and I'm the medical director of the organization. Whole person care acknowledges that the best way to care for people with complex needs is to think of them as whole, complex beings with intersecting and inseparable needs: medical, behavioral, socioeconomic, and beyond. This has never been true more than now in 2020, the year of COVID-19 and Black Lives Matter. Luckily, HealthPoint was well set up for this challenge because we've always had an integration of medical, dental, behavioral health, complementary and integrative health, and pharmacy. What has changed this year is that COVID has made health disparities much, much worse, and racism and its toxic and deadly effects have been drawn into sharp focus. And of course, COVID-19 and racism are also connected. Certain racial, ethnic groups and low-income populations are more at risk of getting sick and dying from COVID-19 in at least 4 ways. Discrimination and racism themselves can lead to chronic and toxic stress that in and of themselves increase chronic disease and put some people from racial and ethnic minority groups at increased risk for COVID-19 complications. Housing is also an issue. Some people who are low income live in crowded conditions that make it more challenging to follow prevention strategies. And some people also live in multi-generational housing that makes it difficult to physical distance from those at risk. There's also different access to healthcare itself. Possibly more people are more likely to be uninsured or have other barriers such as transportation and childcare to receiving care. And finally, employment. So low-income and minority racial groups are also more likely to be essential workers who have more chances to be exposed to COVID-19, less likely to be able to work from home, and less likely to have paid sick days. So what is HealthPoint doing now specifically to increase health equity and whole person care in the time of COVID-19? We've been working on measures towards increased diversity, equity, and inclusion using broad trainings across the organization, and this has been put into higher gear this year. In the spring, when schools shut down, we had our behavioral health consultants do outreach, phone outreach to adolescents to check in with them and see how they were managing with the increased stress. We have patient engagement coordinators, which has this year include redeployed dental staff who have been calling patients who have tested positive for COVID and those who are high risk for COVID complications and offering help with accessing resources like food and internet. We are doing more to use our Prepare survey, which asks about social determinants of health, including exactly what needs our patients have. And of course, there's an increased use of telehealth now, and as we roll out our video options, we have a focus on getting all families access to video, which we know is a better platform than phone only. And finally, we have a clinician study group that has formed this year looking into how race is used improperly in medicine to determine who gets which resources.